Sonam, can I start? Okay, good afternoon, everyone. Thank you so much for joining in for this afternoon session on COVID vaccine updates and post-COVID complications. I am Dr. Umang Agrawal. I'm an infectious diseases specialist working at Hinduja Hospital, Mumbai. So it's been around 3 or 4 months since I last spoke to all of you regarding the COVID vaccines. Recently, we have been getting a lot of inquiries about which vaccine to take, whether whether these vaccines are going to be effective against the variants that are coming in, and what are the kind of post-COVID complications that we should expect. Just to answer these queries is why we arrange this webinar, so that majority of the doubts can be cleared that way. So moving on to the talk, before we start anything, let's just revise what exactly is the funda of giving a vaccine. So what happens in a person who gets infected? Whenever you have an infection that enters into the body, your body generates an antibody response. It's basically like an army of antibodies to fight that infection. And eventually, after fighting that infection, the infection clears off. So this is how the normal course happens. What happens if you vaccinate a person? So in vaccination, what you are doing is that you are just introducing either a component of that particular bug or the entire bug, which is, however, inactive. That is, it's not really going to harm you. However, it will provide a stimulus for the body to generate an antibody response. So in case you do get infected with a new bug, with actually a bug that is going to harm you, you already have a host of antibodies to actually be there to fight that infection for you. That is the entire fund of vaccination. It helps in preventing the disease. It helps in reducing the severity of the disease. So just to reiterate, why should we vaccinate ourselves? It helps in reducing the chances of getting the infection because you already have the antibodies to fight that infection. It reduces the severity of the disease, which is absolutely important. Even if you do get the infection, but if the disease is mild, majority of the patients get well that way. It will reduce hospitalizations due to infection, and it can prevent deaths due to the infection. So that is the entire fund of vaccination. So now, after revising these particular topics, let us go on to the main topic of the day. That is, what are the present updates as far as COVID-19 vaccination is concerned. Now, fortunately, recently, Bharat Serum has released its data on Covaxin. So the last time when we spoke about this, our entire talk was focused on the interim data analysis. Presently, Bharat Serum has released the entire document of its phase 3 trial. And what did it show? That in 25,800 participants all across India, when they compared the efficacy in patients who received Covaxin compared to those who did not, after 2 weeks of the second dose, they found that Covaxin had a 78% efficacy against symptomatic COVID-19. It had 93% efficacy against severe COVID-19. It had 64% efficacy against asymptomatic COVID-19. And it provided around 65% protection against the Delta variant. Now, just to interpret these particular results and to clarify a bit more as to what this efficacy means. So suppose that you have two groups of 100 people each, all right? In one group of 100 people, you give a vaccine. In the other group of 100 people, you do not give the vaccine. In the group that actually received the vaccine, 5 patients developed their disease, while in the group that did not receive the vaccine, 10 people received the disease. It basically means that the vaccine was able to prevent 50% of the infections when it was administered to the patient compared to the one who did not receive the vaccine. All right. So now with this particular perspective in mind, if you actually look at these figures again, 70% efficacy against symptomatic COVID-19 is basically that it helped in preventing symptomatic COVID-19 in 78% of the individuals, and so on. So this was the data for Covaxin. Please understand that it is still a preprint. Basically, it has not been peer reviewed by the other by the other scientists. It has still not been published in a recognized journal. However, this data seems to be particularly encouraging. The other kid on the block is Sputnik. This particular vaccine was actually produced in Russia, and we just have an interim analysis of this particular trial, phase 3 trial, that has come up in Lancet. It is one of the most respected journals in medical field. What did this particular trial show? That out of 19,866 participants, when they saw the efficacy of this vaccine, 21 days after the first dose, they found that it prevented 91.6% chances of you getting COVID-19 in patients who were in the elderly age group, that is, who are more than 60 years of age. Approximately a similar tendency to reduce the chances of getting COVID-19 was also seen. So these are excellent results. Of course, we still don't have the final data as yet. We are still waiting for the final results to come in, but it seems very encouraging as well. When we actually compare the three vaccines that are presently licensed in India I would just like to highlight a few points. Each of these vaccines has approximately 60 to 90% efficacy against preventing COVID-19, around over 90% efficacy against reducing severe disease. So even if you do get the infection, the chances of you developing a severe disease are absolutely minimal. Now, the new data that has come in also shows that in patients who belong to the elderly age group, more than 60 years, more than 65 years, around 70 to 90% efficacy in preventing COVID-19 in those particular age groups. And as far as the efficacy against the variants are concerned, we are still building up our experience on that. But the recent data released by AstraZeneca for Covishield showed that if you are taking the Covishield vaccine, this is the data coming in from Canada, it showed that it protected around 87% of the patients against death because of the Delta variant, and around 70% of the patients against the disease if they had the Delta variant. For Covaxin, the efficacy against the disease is around 65% if it's a Delta variant, right? So we're still building up our experience. We are still getting data about the efficacy of these vaccines against the Delta variant, which is the new talk of the town. It is supposed to be more infectious. It is supposed to be more lethal. Those are just the rumors that are coming around. We still don't have absolute data to really conclude this particular thing. So that is how it is. That is how this is. Now, a common question that is generally asked to us is vaccines may definitely not work against the new variant. So which are these new variants? This must be the Delta variant or the Delta plus variant. Should I still take the vaccine? If it's not going to be useful, why should I even take the vaccine? Why should I subject myself to this? So just to answer this question, I would like to give you the example of United Kingdom. Now, if you look out here, the third wave of COVID-19 in UK has just recently ended. Look at the number of cases and the rapidity at which they actually rose. So this is the time period, that is over the past 1 month. There were a lot of cases of COVID-19, despite around 50 to 60% of the entire population being vaccinated. What is more interesting in this point is, despite such a high increase in the number of cases, there were hardly any hospitalizations, which is the entire purpose of vaccination, isn't it? Moreover, the dark blue thing out here that basically suggests admissions in ICU. There were hardly any ICU admissions, and if you look at the deaths, there were hardly any deaths. Despite the increase in the number of cases, the patients did not really they were not really required to get admitted. They were not really required to get into the ICU, and there were hardly any deaths. So that is the power of vaccination. If you have read the newspapers recently, one of the concerns about the present problem in UK was that this particular wave is because of the Delta variant. And out there, they have been using the Covishield, that is AstraZeneca vaccine, as well as the Pfizer vaccine. Despite the use of these vaccines, it was able to prevent hospitalizations, it was able to prevent severe disease, it was able to prevent deaths. Look at the amount of vaccination that has happened till date. At least one dose of the vaccine has been taken by 70% of the individuals in the UK, and around over 55% of the UK population is fully vaccinated. Quite a good amount, quite a large number of people have been vaccinated this way. Now, put into perspective the present Indian condition. It's highly unfortunate that it's just 7% of our population which has been fully vaccinated. So we still have a very long way to go. And the hesitancy about not taking the vaccine is something that needs to be really addressed. If there are any concerns about this particular point, please go and consult your physician. The more you vaccinate, the better are the chances of you getting a less severe disease, better are the chances for you to go into the ICU, better are the chances of you not losing your life. Even WHO recommends that we must not put off getting vaccinated because of our concerns about the new variants, as is very evident from the UK model that I just showed you. Another common question is, so this was a question that has been ongoing for a long time, that I'm concerned about blood clots with COVID-19. Should I really take this vaccine? So please understand that the incidence of clots with COVID-19 or with rather any other vaccine is one episode in 100,000 exposures. So if you're vaccinating 100,000 individuals, one person might get a blood clot. Compare this to a situation wherein you don't take the vaccine, all right? So what is the incidence of blood clots in a population that does not really take the vaccine? It's around 0.22 to 1.57 per 100,000 per year. So basically, there is really no difference whether you are taking the vaccine or you're not taking the vaccines. The incidence of brain clots remains around the same. The protection, however, that the vaccine provides you against COVID-19 is too much, too great. You understand? So it's really important for you to at least get vaccinated. Even the European Medical Agency opines that VITD, so that is vaccine-induced thrombocytopenic thrombosis, sorry, may be a rare complication of COVID-19, but the benefits of vaccination far outweigh the risk of associated complications, as is clearly seen by all the models. Now let's come to our Indian experience. As recently as around a week ago, our Indian Army, the officials from armed forces, they actually published a paper of 1.59 million healthcare workers who had actually received Covishield. And what did they find? 93% of them were protected against infection compared to those who did not take Covishield. So that is a huge number, and that this is our own Indian data in our army personnel. Obviously, vaccination does work. So this is as far as the present updates and the types of vaccines are concerned. A few points about the present status of COVID vaccination for pregnancy and in lactating mothers. Recently, the government of India have made pregnant as well as lactating mothers eligible to take the COVID-19 vaccine. Why have they really done that? Basically, pregnant patients who get infected with COVID-19, they are at a higher chance of having a severe disease, higher chance of ending up in the ICU. The babies of the mothers who are actually pregnant, so 95% of them will actually deliver properly. There will be no issues there. However, there are 5% of the babies which might get some complications, just preterm birth or stillbirth or something like that. So to prevent these particular complications, COVID-19 vaccination is now recommended for pregnant as well as lactating women, that is breastfeeding women in India. Important subgroups of pregnancy, subgroups of pregnant women who might be at a higher risk of severe disease. So that would include women who are more than 35 years of age, those who have one or more other comorbidities like diabetes, hypertension, and those who have obesity. I've just provided you with the resource out here. This is the Indian government recommendation on COVID-19 vaccination in pregnant women. I highly recommend that you guys go through this for any further information. Now, after completing the talk on COVID vaccine updates, let me just go through a few post-COVID complications that you need to be wary about. Post-COVID infections are quite common. However, I'm just going to focus my talk on this particular topic on mucormycosis, commonly and popularly known as the black fungus, which was seen in quite a high amount in the previous wave that we experienced in Mumbai. So this particular, what exactly is mucormycosis? Basically, it's a fungus, and the spores of this fungus is present all across around us. Even you are basically exposed to that particular fungus, even I am. And whenever you are inhaling, those spores might actually come through your nose, into your sinuses, into your lungs, into your trachea, and that is how that particular airway gets colonized. However, not everyone is going to develop an invasive disease. Why is that? Because we have a decent enough immunity to ward off any invasive aspect of mucormycosis. However, it has been seen that there are certain high-risk groups, and especially in patients with COVID-19, who have basically a reduced immunity, as a result of which the spores of this particular fungus that you're inhaling, that can cause an invasive disease. It can first cause problems in your sinuses, from there it can go into your eyes, into your orbit, and from there it can even go into your brain. We have also seen patients who have come in with lung involvement of mucormycosis. Another important point to note that black fungus, as it's popularly called, the mucor, as it's popularly called as black fungus, it's actually a misnomer. So yes, it does appear black when you actually grow it in the medium. However, it is not really known as a black fungus. There are a few myths about mucormycosis that I need to address here. One of the common myths that was ongoing when we had the mucor pandemic, if I may say, was that it may be transmitted from humans to humans. And the other one was it may be transmitted through oxygens, humidifiers, zinc, prolonged mask use, etc. So with respect to transmission, please be rest assured that mucormycosis is not transmitted between humans. So if you are in a room with a patient who has mucormycosis, you will not develop mucormycosis. Please understand that. How do we actually get mucor? It may be because of inhalation. As I said, sometimes if we are ingesting contaminated food products such as decaying vegetables, decaying tomatoes, and other groceries that way, we might sometimes get mucor because of that. And the third one is inoculation. So if you have had any accident or any accident elsewhere, sometimes this particular organism is even present in the soil. The wound contamination by the soil can actually cause mucormycosis. The second common myth is that it is transmitted through zinc, humidifier, oxygen. These are the common treatment options which were being used in the management of COVID-19. And there was a lot of concern about this particular disease through these particular mediums. To that, I just have to say that this great man had said that it is a capital mistake to theorize before one has data. And I would rather say that it is all the more a mistake to actually publicly say about these things before you actually have enough data to prove it. This particular gentleman was sort of Arthur Conan Doyle. So we really don't have enough data to really be very staunch that it can be transmitted through zinc, it can be transmitted through oxygen. That is still a myth. We don't have any data to support it. So please do not believe in this particular aspect. We do know what are the important risk factors on predispositions. We know if a patient has an uncontrolled diabetes, overzealous use of steroids, if the patient has any malignancies, if they have any condition that can reduce your immunity, such as patients who have undergone transplant. So this is a particular subgroup of patient which is at a higher risk of developing an invasive mucormycosis. This was an article released from India to which we had contributed to as well about COVID-associated mucormycosis. It has been published on the CDC website. And what did it say? What did it show? That patients with COVID-associated mucormycosis, around 30% of them only had COVID as a risk factor. So that is also very interesting, that only COVID was responsible for the occurrence of mucormycosis in this particular sector. We still don't know how COVID basically manipulates the immunity to make you more susceptible to mucormycosis. Studies are on way for this particular topic. But yes, if you have COVID-19, there is a higher chance of you actually getting mucormycosis. So how do you basically suspect that I can actually get mucor? So these are the important signs and symptoms to look out for. So you have had, as you have had COVID-19, you have recovered, you are well. However, at home, if you develop any of these particular symptoms like any nasal stuffiness, any bleeding from the nose, any blackish discharge coming from the nose, any problems while seeing, bulging over the eyes, swelling over the eyes, redness over the eyes, any swelling over the face, unexplained fever which you're not able to understand, lots of headache, your cough is worsening, you have some blood and cough. All these are common symptoms that mucor might present with. So whenever you have any of these symptoms, please go and visit your doctor immediately. Please don't ignore them. It's always safer to just consult rather than ignore. Moving on, so this was one of the complications of COVID, which we may see post-COVID-19. Second important complication, and quite commonly seen as called, complication is called lung fibrosis. So what exactly is lung fibrosis? This is the normal CT scan of a normal patient. You see this is your lung window. All your lungs, they are absolutely clear. What happens in COVID-19? COVID-19 actually goes and affects your lung. And when you are recovering, the lungs also start recovering. Sometimes what happens that during this particular recovery, there is some fibrosis of the lungs, as a result of which the lungs have a tendency to contract. So this is what happens in fibrosis. You see all this honeycombing pattern? What happens in fibrosis? Obviously, you can understand that the capacity of the lungs in this particular situation is obviously reduced. As a result of which, your oxygen levels are also low. Whenever you're walking, you start feeling tired immediately. You start feeling breathless more fast. This is what is post-COVID lung fibrosis. What are the important risk factors? In which particular patients do we particularly look for this particular complication? Patients who have had COVID-19, who belong to the elderly age group, who have had a severe disease, who are in the ICU, they had required mechanical ventilation, those who have been chronic smokers, or those who have been consuming alcohol for quite some time. So these are the important risk factors which eventually may lead to the development of post-COVID fibrosis. Now, there's one good thing that majority of these patients recover without any treatment. They just recover by themselves. So that is very, very encouraging. However, sometimes you might require some oxygen therapy to continue at home. You might just require some steroids to continue. Pulmonary rehabilitation is extremely important. And please understand that once you have recovered from COVID-19, you should definitely get vaccinated, not for COVID, for COVID as well later on, but for seasonal flu, for pneumonias, So that particular vaccine is also important. It does not really prevent the occurrence of post-COVID fibrosis. However, if you do get an infection in the setting of a fibrosis, then the clinical course and the management of that particular patient becomes very difficult. Please understand that whenever you are discharged from a hospital setup, there is always an advice for a follow-up to follow up with your doctor. There's always that advice. Please follow up that advice. These are the important key things that we are looking at if you have developed any of these symptoms. Another important complication that we commonly see is clotting disorders. So we know that in COVID-19, the blood has an increased tendency to clot, which has been evidenced by multiple studies. And interestingly, even after you have recovered from COVID-19, this increased clotting tendency of the lung might persist for over 3 months. So even though you have recovered, there is always a chance that you might develop a clot later on. Where can these clots come in? They can come in your lungs, they can come in your heart, it can present as a myocardial infarction or a heart attack. It can sometimes come in your brain, causing a stroke, and it can even come in your legs, as a result of which your legs, they start swelling up, they start paining, etc. The general management for this particular complication is just blood thinners, and that is why you need to maintain a regular follow-up with your doctors as well. Basically, because this is a post-COVID complication, you can get these problems even after you have been discharged. So we ask you to constantly monitor your D-dimers. That is basically a marker of the clotting tendency of the lung. Clotting tendency of the blood. If the D-dimer values are significantly high, then you might require some blood thinners as well. And lastly, there is a syndrome called long COVID syndrome. The pathology of this particular syndrome has not really been, we are still not clear as to what really causes this. But what is this long COVID syndrome? Let's start with that first. So once you have recovered from the acute stage of COVID-19, there are certain symptoms which will still persist. You will become more fatigued. You might have some lethargy. You might have some chest pain, cough, etc. And these symptoms might persist for over 4 weeks. So these are the other symptoms. You might get a bit foggy, loss of taste, loss of smell. I've seen patients who don't recover their taste and smell for over 2 or 3 months as well. So don't get alarmed by it. It is just the natural course of the disease. It will eventually come back. Lung complications like cough and chest pain, along with some breathlessness, which I spoke to you about. You might develop a rash. Sometimes you might even develop symptoms such as depression, stress, anxiety, social isolation, very commonly seen in the last wave that went by. Lots of palpitation. Sometimes COVID, after you have recovered from COVID-19, your heart might not function that well. That will cause that will cause a feeling as if your heart is beating very fast. So that is palpitations, joint pains, etc. This is the long COVID syndrome. The management of these particular symptoms are generally more conservative. You just have to give them some supportive care. Depending upon which particular organ is involved, you might go in. You might need to go in for imaging. All these things will depend upon how your doctor sees you best that time. So please make sure that if you have any of these symptoms, please feel free to consult us. We are always here to help you. And this is something that you need to be wary about. So these are the important post-COVID complications that you need to know about. And just to conclude, that this was a very interesting statement made by Mark Lipsitch. He's an epidemiologist. And he said that we are just clambering into a life raft. Our land is far away. This was in terms of COVID-19 hitting USA. And in April 2020, when USA had started seeing the worst of COVID that time. Now, at that particular time, he said that we had just, so that is the time when the medications had just started coming in. There was some hope for COVID, etc. So that's how the statement was made. I would say that the situation has probably, it's improved much more compared to how it was before. However, we are still on that particular life raft. I think we have already got onto that life raft, but the dry land is still far away. We are still not there. What will get you there? I think vaccination will get you there. You can see the UK example. This was the recent Wimbledon 2021. This was the pre-COVID era. Can you just imagine, just within 2 years, this was the scenario in United Kingdom and London during Wimbledon. They have achieved around 50% vaccination rates in the entire country. There will come a day when we can actually vaccinate ourselves as well to that extent, and we all will cheer India together. Thank you. Thank you so much. Sonam, are there any questions? Hello?
Yeah, doctor, can you hear me?
Yeah, tell me.
Yeah, so the first question is, I feel I'm having side effects of first dose vaccination. I feel my nerves have got affected. I get pain in chest. What remedy do you advise, doctor?
Okay. So basically, as I said, and as far as post-COVID complications are concerned, this could be because of some long COVID syndrome. You're getting some pain, you're getting some aches, some joint pains, etc. Probably you can just take some paracetamol and see how you're feeling. If the symptoms are severe enough, you need to come and consult one of the doctors, one of your doctors there, so that they can actually examine you and they can try to help you further. But for the present, I think some painkillers, some hot compresses, etc. I think that should be used.
Okay, the next question is, what symptoms persist in patients with post-acute COVID-19 syndrome?
I'm sorry, I didn't get that.
What symptoms persist in patients with post-acute COVID-19 syndrome?
So once you have recovered from COVID-19, as I said, there's something called as long COVID syndrome. You can have prolonged fatigues, prolonged lethargy, some fogging in your brain, loss of smell, loss of taste, which are persistent, which might take around 2 to 3 months to recover. Sometimes you might experience some chest pain, some palpitations, some pain over the legs. You understand? So all these are the common symptoms that we can look out for. And the important symptoms which really need you to go and consult your doctor are cough, worsening cough, any swelling over your face, any discharge from your nose, any headaches, any swelling over your eyes. All these are very, very important symptoms. It might just indicate that there is some kind of an underlying fungal infection somewhere which needs to be caught and treated early. These are the symptoms you guys need to look out for.
Okay, the next question is what helps in post COVID recovery?
Generally, only conservative management should be enough. Please understand it also depends upon what kind of infection you've had. If you have had a mild infection, moderate infection, severe infection. So generally, prolonged recovery is seen in those patients who have had a severe infection who have been in the ICU for a long time. And in those patients, you need to go in for some rehabilitation. Take it easy, just take it easy, basically. Go slow. Whatever symptoms you have, you just take conservative management for that. In case those symptoms are not being able, if you're not able to manage those symptoms elsewhere, you might want to go and consult your doctor again to see if they can help you out. It depends upon what symptoms you have and what kind of disease you have had.
The next question is for how many days after recovering from COVID-19 can a patient catch black fungus?
So up till now, whatever they have shown, generally between 6 weeks to 3 months is what they say after the date of symptom onset. So suppose you had symptoms on the 30th of July, for example, today, you might get mucormycosis within 6 weeks to 3 months.
Okay, the next question is there any chance of long COVID symptoms even if mild COVID post two vaccinations?
Yes, quite possible. As I told that we are not really sure as to what is the cause of the long COVID syndrome. How does it really come into play? But yeah, there are certain patients who might have some mild symptoms to begin with COVID-19, those who have already been vaccinated. But we have seen a few patients who may have these kind of symptoms which might persist longer. But there's nothing to worry about. That is more important in the sense you have to continue with your conservative management. Definitely go and consult your doctors as well in case there is any other new problem that comes up. That's how it is.
Okay, the next question is what are the initial symptoms of black fungus? What is the difference between black, white, and yellow fungus?
All right, so this is a decorated misnomer, as I said. There is technically in medical language, there is no black, no green, no yellow, no white, no pink, nothing. Right? Fungus is a fungus. It depends upon what type of fungus it is. So generally, the black fungus refers to mucormycosis in the current setting. And as far as the green, white, yellow, etc., they are different types. There are different kinds of fungi. Some might be aspergillus, some might be candida, etc. Now, the common symptoms that you need to look out for, as I said, it depends upon which part of your body has been affected by that fungus. Generally, for mucormycosis, it's more of the sinuses. So you might be getting some swelling over the face. There might be some ulcers which might develop in your mouth, some discharge from your nose, blackish thing coming out of your nose. Your eyes might start becoming red or vital swelling. In the sense, there is swelling over the eyes. You might develop new onset headaches. Sometimes if there is lung involvement, then your cough remains persistent, chest pain increases, breathlessness worsens. So these are the important symptoms of mucormycosis that you need to be on the lookout for.
Okay. The next question is will we need to take the vaccines once every year?
I'm sorry?
Will we need to take the vaccines once every year?
Uh, is it in terms of COVID-19 vaccination?
Yes, yes, yes.
So not really. So that is not really recommended at present. Presently, what is recommended is you take 2 doses of your vaccine. Now, recent studies have shown that, especially with Covishield, the duration of immunity is also quite long. So whether you will require a repeat dose the other year, we are still not sure of that. It's possible that this particular disease might become something like influenza, where you require a yearly shot for influenza vaccine. But presently, I think we are still too naive to really understand this particular disease. So presently, just take 2 vaccines, you're done with your vaccination. And eventually, if there is more data, more literature on this, then that is something that we can talk about that.
Okay. The next question is a person above 80 years age, what precautions after post COVID to be taken?
There are no specific precautions to be taken. Just be wary about the symptoms, as I said, the warning signs. As I said, about the swelling over the eyes, swelling over the face, worsening cough, breathlessness. if you have more chest pain, any palpitations, any, swelling over your legs. So these are the things, symptoms that you need to be wary about. There are no specific precautions that you really need.
The next question is, people are talking about booster dose. Can you please explain?
So the concept of the booster dose is that once you have taken 2 doses of the vaccine, after a certain period of time, that particular the antibody generated by those particular vaccines, they might wane, for which you might require a booster. So that's the theory behind it. Whether a booster is indicated in the present situation, we are still not sure. We still don't know. As I said, that with as far as Covishield is concerned, we have data lasting immunity for around 6 to 8 months, if I'm not mistaken. Whether after that you will require a booster dose or not, studies are still ongoing for that. So presently, there is no recommendation for a booster dose as yet.
Okay, I got COVID after taking the first shot. How long do I need to wait for the second shot?
So once you have recovered from your COVID, around 3 months after that, you can take your second shot.
Okay. What is a good level of antibody?
If you have an antibody, that's good enough. There is no specific level defined for that.
How long should one take blood thinners after COVID-19 recovery?
It depends upon it depends on various things about your basically your risk profile, your background history, your age, what kind of disease you had, etc. But generally, it also majorly depends upon the D-dimer values and everything. I would say that you continue with your blood thinners till the time your physician has advised you to do.
Okay. After recovering from COVID 6 months ago, I can't taste things as it is used to be. Is it that normal?
Symptoms. So the maximum that I have seen as far as recovery of taste is concerned is around 3 to 3.5 months, not really 6 months. Probably you can consult one of your physicians for this particular thing. There might be other drugs that might be interfering with this particular thing. Sometimes some antihypertensives, which have been newly started, can sometimes affect your taste sensation. So I would suggest that you should go and meet them once. But otherwise, nothing really.
Okay. The next question is, can vaccine prevent black fungus as well?
Not really. So COVID-19 vaccines can prevent COVID-19. It does not really prevent black fungus. So as you know, that COVID-19 itself is a risk factor to develop a black fungus or mucormycosis. If COVID-19 vaccination helps in protecting against COVID-19, then it probably might have a role in protecting mucormycosis as well. But there is no real study, no real literature which shows that if you use a particular vaccine, then you won't have mucormycosis.
Okay. After first COVID positive report, how many days we should wait to get vaccinated? Okay, you have already answered that. It's 90 days, I guess. Okay, the next question is, what is the possibility of getting infected from COVID again if you have already been infected and recovered?
It's possible. So reinfections are known. And so all your doctors would always advise you that once you have had COVID-19, do not abandon the social distancing measures. You still need to you still need to wear your mask. You still need to maintain social distancing, and you still need to maintain hand hygiene. So yes, there is always a chance that you might get reinfected.
Okay, the next question is, after being operated and recovered from black fungus, what are the chances of its reoccurrence?
What are the chances of?
Reoccurrence.
I didn't understand. Sorry. If you have recovered from black fungus, what are
Yeah,
the chances of recurrence?
yes.
So please understand that mucormycosis is a very difficult disease to treat. The general treatment recommendations are between 3 to 6 months at least, depending upon what the clinical profile is and how much of the disease have we been able to come under control. Once your treatment is over, generally 3 monthly or 6 monthly scans are advised to make sure that there is no recurrence of disease. But there is always a chance that it might recur again. So it depends upon how well your sugars are controlled, how well you have controlled your weight. All those things also matter a lot in this particular thing. It's a very difficult question to answer, but this is the best that I can give.
All right. So, doctor, we'll take the last question for the day. The question is, which organs are most affected by COVID-19?
So the main organ that is affected is obviously the lung, but we now know with over 1 year experience in treating patients with COVID-19, it can practically affect all parts of your body. It can affect your heart. It can cause myocarditis, basically inflammation in your heart, wherein your heart does not pump properly. It can sometimes cause some holes in your gut, can sometimes cause problems in your liver. It can cause problems with psychosis, some brain issues. It can cause seizures. So basically, it can cause anything and everything under the sun, but the most commonly involved organ still remains the lung.
All right, doctor, thank you so much for the talk. So, any takeaway message you want to give? Hello? Hello? Yeah, doctor, any takeaway message you want to give?
So it's very important to understand that we are still at a very low level of overall vaccination rates in our country. You have any concerns about taking the vaccine, any hesitancy about taking the vaccine, please come and speak to us or speak to your doctors about it. It is absolutely important to get yourself vaccinated. You can see what has happened in the UK. Even despite the increasing number of cases, there were hardly any hospitalizations, hardly any deaths. But that is the power of vaccination. Please go and take your shot right away. Only with vaccination can we actually come back to a pre-COVID setting and live our lives normal way again.
All right, doctor, thank you so much for the talk. And if anyone wants to book an appointment, you can go to our Hinduja Hospital website, that is www.hindujahospital.com, or you can call us on 022 All right, doctor, thank you so much. Thank
Thank
you
you.
all of you for joining the session.